I think, vaccines are interesting because they're one of relatively few interventions that are distinctly both medical interventions as well as public health interventions. And they bring in all those different perspectives and outlooks that come with each of those domains. A lot of our public health policies that are often contentious, right? Whether it's about taxes on cigarettes or motorcycle helmets or seatbelt laws or other kinds of traditional public health campaigns are not delivered in the context of a doctor-patient relationship where we might think about those issues about risks and benefits and individual consent. And conversely, lots of our medical interventions don't come with those clear public health benefits that vaccination provides as well. If we think about a decision to receive a statin or a cholesterol drug, there might be concerns for one's loved ones if one doesn't comply with that, but the community benefits of vaccines straddle both domains. And I think that's been both a blessing and a curse for how we think about them and talk about them as a society. And the fact that that public health benefit is exactly what has been the foundation of policies, again, for almost 200 years that would compel some vaccines for some populations absolutely has been a lightning rod for public attitudes, public resistance to vaccines in the past, and remains so to this day. So I think that's a huge part of the conversation why vaccines are so often contentious or so often seen as a source of opposition or concern. The other one is the fact that, listen, we have a recommended vaccination schedule that for most children, there are a battery of vaccines that are given on the scale of several million doses a year to kids, all for good reason, all with good evidence supporting their evidence for safety and benefits, but also creating lots of opportunities for concerns to emerge of a vaccine being associated with all of the kinds of conditions, developmental or otherwise, that emerge in children in the